And the recording will be posted to the committee's webpage after the meeting. And for everyone's reference, today's agenda can be found under tab 1 in the meeting materials. It is now 8:38, and I call the July 17th Nominating Committee meeting to order. And we're going to go ahead and dive right into the overview of the agenda. With roll call is where we'll begin, and then we're going to open the floor for public comment. After that, we'll review nominations submitted for consideration for the Healthcare Cost Transparency Board advisory committees. And then we are going to review the advisory committee application form and then wrap up today's meeting. So quick roll call. Ingrid.
Present.
Thank you. Carol.
Here.
Thank you. And Kim, I'm not sure if there's a way to confirm if that's you or not. Okay. So Kim, we'll just put down as a question mark. Okay. We'll jump into the public comment to begin. If a member of the public wishes to provide public comment at this time, please raise your hand. When you're called upon, please state your name and affiliation, if any, before speaking. And I do not see anybody with their hands raised. I do not see any additional people on the attendee list. So we will go ahead and close public comment and move to the next section of the agenda, which is to review the nominations under tab 3. So we have 2 nominations to review today. The first is David DiGiuseppe, who submitted consideration to be a member of the Data Issues Advisory Committee. David is the Vice President of Healthcare Economics at Community Health Plan of Washington. He also serves on the Universal Healthcare Commission's Finance Technical Advisory Committee, known as FTAC, and on the committees led by the Health Benefit Exchange, Accountable Communities at Health, and Washington Health Alliance. So I'm going to open it up now for you guys to have a brief discussion about David, and then we will move to a vote.
Thank you. I am familiar with David and his expertise and appreciate the crossover with the other entities with related business. Can you just clarify, do we have any, what are the number of slots, if you will, available on the data committee, and does it match the number of recommendations for today?
Great question, Ingrid. So unlike the Healthcare Stakeholder Advisory Committee, which is stated in House Bill 2457 and 1508, that has very specific requirements around who can serve on the advisory committee, the Data Issues Advisory Committee does not have such requirements. There's no specific numbers, and there are no set requirements in terms of like what the members have to represent or entities or organizations they have to be affiliated with. The only requirement is that they do have to have background knowledge, subject matter expertise in healthcare data.
Great, thank you.
Yes.
I have no questions and appreciate Ingrid's knowledge or awareness of the applicant. That's helpful for me. The resume was quite brief and I'm not familiar with him. So that's helpful for me in considering him. Thank you.
Yeah, so it looks like I just got an email from Kim saying that she is trying to click on the link for Zoom, but getting no connection. She's going to keep trying. So let me just double check real quick before we move to a vote. Oh, okay, it looks like she joined. Kim, are you on now?
Looks like she's here.
Yes, hi. Yeah, no, I was getting no action on the link. I'm sorry. And my Outlook, I sent you the message, but Outlook and my Outlook was not sending messages. So you couldn't even get that. So I called in and then you couldn't hear me on the phone either. So I was completely like, I could hear everything you were saying, but you couldn't hear me saying, can you hear me now?
We assumed it was you, but I just didn't have confirmation it was you.
I had to, That's okay. I just completely logged out and came back in, and now everything seems to be working. Thank you.
I'm glad it worked, and thank you for joining us, Kim. So I'm not sure if you did hear the summary, the brief summary I gave about David.
Yeah.
Okay. And then if you guys have any additional questions, otherwise we can move to a vote.
No additional questions on my part.
Okay, thank you, Ingrid. Okay, would someone like to make a motion to recommend David as a Data Issues Advisory Committee member to the cost board?
So moved.
Thank you. Is there a second?
Second.
Thank you, Carol. All in favor, say aye.
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 Great, thank you. So David is approved by consensus and will be brought for review at the next cost board meeting. The next nomination we have today is Michelle Ritala, who has submitted for consideration for the Healthcare Stakeholder Advisory Committee. So to answer your earlier question, Ingrid, this is the advisory committee that does have very specific requirements in terms of who can serve and what areas they have to fulfill to be able to be appointed on the advisory committee. So she would be fulfilling one of the additional members that is now required because of House Bill 1508, which passed this year. So she would be filling in the role of labor purchasers. So the section says at least 2 members representing the interests of employer purchasers, including 1 small business representative selected from a list of nominees by business organizations. And Michelle has her master's in public administration and currently works for King County Department of Human Resources. She has 20 years of experience in employee health benefits management for up to 340,000 lives. Her prior experience includes managing health benefits at Puget Sound Energy and Washington State Healthcare Authority for the PUB program. So I will now open it up to you 3 for a brief discussion, and then we can move to a vote when you're ready.
Work with Michelle in many different capacities, and she's a great applicant to consider for this committee. So in certainly, I have no questions about her background and ability to serve.
Great, thank you, Carol.
Likewise, I would agree with what Carol just said. I do have a question about purchaser representatives. I can't remember how many public purchasers versus private purchasers we have, and if they're sort of medium or large private sector purchasers.
Yeah, good question. We can move real quick just to show you to the next
I know you
section.
sent the
Yeah, it's under tab 4, Audrey.
list.
Next page.
Mm-hmm.
Right here, it outlines the appointments to the Advisory Committee of Healthcare Stakeholders must include the following. So
Right.
the first section, which is I through XII, was laid out in House Bill 2457, which was the original advisory committee, previously titled Providers and Carriers. And
Mhm.
then the lower section, which is what Michelle would be fulfilling, is the additional members that have been expanded from House Bill 1508 this year. So I think it might be on the next page.
Next one.
Yeah, at least 2 members. Sorry, it's really small on my screen.
Small business and nominees by business organizations, right?
Yes.
Okay, 2 members and 1 small business. So Michelle wouldn't be the small business.
Right. We already have someone for the
Right.
small business.
Right. And so she would be the other one.
Right.
Okay. And she was selected from a list of nominees submitted by business. Is that true?
I don't know if she was selected from a list of business nominees. I can look into how exactly she was nominated. I know that her resume did come into the cost board stating her interest in participating on the healthcare stakeholder advisory committee, but confirming how she was in fact nominated to give you guys those details. Unless
Yeah,
Teresa, you remember off the top of your head. I don't know if Teresa can talk either. I don't know if she's a panelist. Okay.
I'm trying to talk. I put it in the chat.
Oh, Puget Sound Business Group on Health nominated her. Oh, okay. That's good. Oh, yeah, good. Yeah, I just was trying to cross the T's and dot the I's here. You know, it's not, and King County is a member of the group. Yeah, because it's not any, my comments are not at all about Michelle. It's more just wanting to make sure that
Okay.
the
The
representation.
due diligence to make sure like
Yeah.
we're covering each one of the specific requirements.
Right.
Yeah.
And certainly King County is a significant employer purchaser. So I don't see anything. I see, you know, it seems consistent. Thank you. I think that one kind of in the back of my mind, one of the things that, you know, I always, you know, are trying to keep in mind about representation is the people and organizations who are oftentimes participating in efforts like this. You know, a lot of times the same names come up.
Mm-hmm.
And I think it's important, you know, while, you know, people, it's a balance because, you know, I appreciate Teresa, your comment there. Yeah, I think that's the point I'm concerned about and trying to make is that, you know, I think that the usual suspects, you know, and the people that we're familiar with, who have broad and deep expertise, very relevant expertise and experience, are naturally very attractive. But sometimes it's easy to be, you know, inadvertently to be, you know, a bit more insular than we, you know, would best serve. So that's just a comment, you know, if I have in the back of my mind, always trying to keep that in mind. But thank you. I do support Michelle's nomination, and I think that she, you know, is really would be a very strong contributor.
Great. Thank you, Kim. And to your point, I know you did mention that in our last nominating meeting, and Teresa and I did really take that into consideration as we put together this nominating application, or not nominee, application form to serve on one of the advisory committees. And so that's what we'll be discussing next. But in terms of Michelle, would someone like to make a motion to recommend Michelle as a stakeholder advisory committee member to the cost board?
Yes, this is Ingrid. I would like to do that. I think she is a very strong representative of the perspective of a large employer purchaser and really appreciate her expertise. So strongly recommended. And Kim and Carol, thank you. Kim, thanks for your clarifications.
Great. Thank you, Ingrid. Is there a second?
Second.
Thank you, Carol. All in favor, say aye.
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 Thank you. Approved by consensus, and Michelle will be brought for review at the next cost board meeting. And then next, we will return back to the application form under tab 4. And the purpose of this form is to clearly lay out the steps individuals could take to submit their candidacy for consideration for review to the nominating committee to serve on either the stakeholder advisory committee or the data issues advisory committee. And so then going back to your point, Kim, we really did want to make sure that we are selecting a wide range of candidates and really taking into consideration diversity and also geographic location too. So we have different areas of Washington represented. So as you can see here, under the qualified candidate section and how to submit application, the category right there in the middle where it says please submit biography, and then it has like those very specific requirements laid forth. So just want to get your feedback on this to see if you have any input regarding this application form, anything that you think that we should add, any comments in general. Otherwise, again, we can take a vote to see if you guys approve this form to use moving forward, and that will also be taken to the cost board meeting on July 30th.
Just one clarifying question, in the application process, do they have a place where they indicate references or who they were referred by?
Yes, it does state that in there.
Sorry. Looking at the small print here. Yeah.
Yeah, I know it's really it's small on
Okay.
my screen. But it does say short biography, short statement on how the nominee's experience and or professional perspective relate to the committee, details, reason for interest. And then, okay, I see what you're saying. Yes, it does look like we're gonna have to specify nominating entity.
Yes, if that's current practice, it seems like it is for the existing people serving and for these new ones that we're approving. So ensuring that there's clarity on who's the nominating entity would be great.
Okay, yeah, so we'll make sure we add that detail in.
Okay.
Kim, I see your mouth moving, but I think you're muted.
So I have a quick question about the information. We're asking for the following information. The last bullet says represent Washington's diversity. And so can you share a little bit more about what represent means? That they would speak to that, or that they have that they actually directly represent a particular underrepresented viewpoint or experience, or I'm not sure if this represent Washington's diversity is information about themselves and their work, or their perspective, knowledge that they will represent Washington's diversity, or that it just wasn't.
That's a good question. Teresa, when we were putting this together, do you remember the details on that? Otherwise, we can clarify based on your feedback the way that you think that it
Right.
should be.
Yeah, I think it should be open. Like, I like your comment up, could it be both? I think it's, I don't mean to suggest a restriction, or, that they have to somehow fit, oddly enough, ironically enough, into a particular diversity slot. That would be not appropriate. But I think, let's see, represent.
So Kim, I just think that I think you can hear me now, correct?
Yes.
Okay, great. Sorry, I've been putting in stuff in the chat because I didn't know you could hear me.
Mhm.
I think it was also so that we didn't have to list every single type of and sort of too narrow, trying to make this just really broad. And if somebody's interested, we want to make sure that they make themselves available, or sort of let us know that, even if we have to go back to them for more information, or send their biography and their sort of nomination form to a body that might have to nominate them for their consideration. Just trying to really broaden the opportunities for people. And I think it could be both. I think they could either be representing themselves, representing sort of a group. I think it's really hard to ask people to represent a group, but
Right.
I think trying to just sort of representing of all the diversity, including geography, including. So that was the reason to be broad. If we should read.
Oh, maybe it's the
happy
word
to wordsmith it.
So represent is the only verb, and it's the only bullet that starts with
good.
verb.
Okay.
And so I think I don't know, I was sort of thrown off by that a little bit, because we're asking for the following information about these things, that they're all sort of nominative phrases, right? Biography, statement of this, details, and then represent Washington's diversity. So maybe it's just representation of Washington's diversity. So we're not saying you represent Washington's diversity, but we're saying, how will you represent, or and just share information about representation of Washington's diversity. It suggests something slightly different to me in my reading. Yeah, just even changing the word represent to representation of.
Ingrid and Carol, what do you think about that? Are you supportive of that?
Yes.
Mm-hmm.
That's
Done.
great. Thank you for the feedback, Kim. Okay, so would someone like to make a motion to recommend this form to be brought to the cost board for final review?
With the 2 amendments.
Yes, with the amendments, of course.
Mhm. Yes,
Is
I'll
there-
move. Yes,
Thank you, Kim.
I so move. Mhm.
Is there a second?
Second. Yes.
Thank you, Ingrid. All in favor, say aye.
Aye.
Thank you. So that is approved by consensus and will be brought for review at the cost board meeting. And I don't necessarily think the cost board has to review and approve, but just bringing to review to let them know the new form that we will be using moving forward for selecting advisory committee members. And that brings us to the end of today's meeting. We will bring these nominations and the committee application form, like I said, to the next cost board meeting just for their review. And thank you so much, Carol, Ingrid, and Kim, for your participation today. And on short notice, we really appreciate it. And the recording and summary of this meeting will be posted shortly on our website. The July 17th nominating committee meeting is now adjourned.
Thank you all.
Thank
Thank
you.
you.
Have a great day.
You too. Bye.